What are some of the signs and symptoms of depression?
One of the tools that we use for screening for depression in adults and children is an acronym. It's called SIGECAPS. It's SIGECAPS. And so they stand for sleep. Are there problems with sleep? Is a child sleeping too much? Which can sometimes be difficult to sort out with a teen. Or are they sleeping too little? Are they irritable? Or they have a lack of interest, that I. Do they feel guilty? Do they have a bad self-image of themselves? Are they having difficulties concentrating? Do they seem more angry? Are they slower than they used to be? So the P is for psychomotor agitation or slowing. Are they seem like they can't settle down, or do they seem like they just have no get up and go? So either way. They're the same presentation in children as they are in adults, except a child will say that they're just feeling irritable, whereas an adult will come in and they will say, I'm feeling sad, down, blue, or depressed. They'll use those words, but a child will, or a teenager will say, I just don't feel right, I just feel irritated or irritable.
I think on some level, dealing with the teen population, some of what you might just have described, people might feel, oh, hey, well, that's a teenager. So how do you distinguish between, I guess, general teen moodiness or teen behavior and when it actually becomes a problem of clinical concern?
You're right, it is challenging, and it's hard for us as providers to tease that out. What we need to do is to, first of all, listen to the child and listen to the parents or the caregivers for the child, teachers. If somebody brings something to our attention and says, there's something that isn't quite right, the child may say, the teenager may say, I don't feel the same way I did, or I feel more irritated than I did, then that should really spark the provider to say, what's going on here? The difference between moodiness or normal teenage blues or mood swings that everybody goes through, whether you're a teen or an adult, is that it really affects your functioning. So is it starting to affect socializing or affect eating? Are they eating too much or eating too little? Are they not going to school? Or do they not want to go to functions? Are they withdrawn? Is it really starting to affect how their life is being lived? And that's really the key between, that sort of mood swings. Mood swings and blues also are short-lived. It may be, a bad day or a few hours sometimes. We all have those little episodes where you're just saying, boy, I'm having a bad day right now. But this is something that you'll see goes on for a few weeks, and that's one of the questionnaires that we use. Whenever a child comes in and says, I'm feeling irritable, or I don't feel like I'm myself, there's a 2-question questionnaire that we use. We say, well, have you felt sad, blue, or depressed, or irritable in the last 2 weeks? How often have you felt that way? And they may give a variety of answers, either not at all, or some days, or most days, or pretty much every day. And then the second question is, have you lost interest in things that you typically like to do? And the same questions, is that every day, some days, most days, or every day?
Are patients coming in seeking treatment for depression, are they usually aware that they're suffering from an illness?
Usually not. Usually somebody comes in and they'll say that they are tired. They may have fatigue, or they say, I'm not sleeping well, or a parent will bring a child in and say, there's something wrong with them. I'm not sure what it is. Their grades are slipping, and I'm not sure why this is going on. Can you test their thyroid, or maybe they have Lyme disease or something like that. Sometimes a patient will come in and say, I really feel like I'm depressed. I'm really sad, and I feel like I'm depressed. But most times, it's some of the other what we call physical findings that present and make the patient want to come in. And some of that may be that they don't want to talk about it, and that's the shame of it. Is it from a provider standpoint? I'm glad that this is coming to the forefront, that people can talk about it more openly and say, yes, depression is real, and it's something that we can talk about and something we can treat.